The governor gave an interview today where she was quoted as saying, with the evidence we have, I think we can open up. Do you agree with that?
We had a discussion today with the economical group, the so-called task force for the economy of Puerto Rico, and there are some assessment of the situation of Puerto Rico, and there are metrics in terms of whether or not there are teams or groups of business or economical groups or areas of interest that could be addressed. We had an open discussion regarding the need to make sure that they recognize the value of PPE, or the need for PPE, the need for a policy and procedure regarding opening business, and specifically a strategy and a certification in terms of which one could open based on the needs of Puerto Rico. So what I've said before is the following, David. First of all, we need to make sure that the health department, the health system is fully functional. And one of the first things that I want to see is that, give you an example, surgeries, specifically what is called elective surgeries, not statical surgeries, but elective surgeries are open to Puerto Rico. That the health department is stronger than what it is at this point in time, that we have all the elements in place. Likewise, I've said, and we have a strong effort to this, is the need to have the physicians ordering the test so that we can have a better data to drive this effort. But indeed, we're going to be looking at some meetings this weekend, within now and Friday, with the governor, the economical team, and the Department of Health, in terms of whether or not there are specific business areas that could open through the course of the next few weeks. I've said before that I see this happening with some modifications to the quarantine or to the order that the governor has provided, but we are not yet at the level where we can say that we're free of risk. And we know that the plateau will be in June. Interestingly, when I met with the people from the VA today, with the data they have, they claim that their worst time for the VA hospital with the data they have was the last week of April, the last week of March, the first week of April, which is interesting, which was a little bit before the data that healthdata.org was providing, which was April the 15th. And they claim they could have a spike, the second spike, on the first week of May, which is what we claim is going to be our worst time. So we're looking at data. There's additional data within the group of Ponce, which is the south part of the island. There's a group of physicians and people in science that looked at data, and they have looked at about 40,000 people that have provided information regarding symptoms. And we were looking at that data also to look at the hotspots. But at this point in time, the recommendation for the governor is going to be that there could be modifications to the quarantine, but it's not going to be complete free opening to the country.
Okay, if you say your worst is going to be at the second week of May, why would you be easing up on anything?
The first week of May. What I'm looking at, whether or not there's going to be areas where they can provide us with, first of all, low risk. They can have all the protective equipment available in place. We can provide them with testing before they start their process. And we can also have a process of tracing with that specific business sector. So we're looking at slowly, progressively increasing the workforce in specific areas that could be of value to the country without compromising the healthcare system.
You haven't been able to secure substantive testing. You can't do more than 200 to 300 tests a day. You have virtually no contact tracing, and the record keeping of the positive results is unreliable because it's been so poorly done in the past. So I don't understand how you're in a position to tell people that you're ready to ease up on anything.
Other indicators, David, include the level of use of hospitals. We have less than 35% of the use of inpatient facilities. We have a significant amount of intensive care unit beds available, probably more than 50% of the available. We have at this point in time in the range of about 1,200, close to 1,200 ventilators, of which we were using only probably 300, 350. So there's other indicators, including the mortality rate or the mortality number, absolute number. We have today 67 people that have been that died related to COVID. Interestingly, and I've been, not me, the system has been criticized in terms of the lack of information, and it goes both ways. We have, of those 67, 46 with positive testing related to COVID as people that have died related to COVID. But you have 21 of them, which is based on the certificate of death, that is attestation of a physician that says that the person could died related to COVID. So when we look, and I agree with you, we have 950 people, 915 people today. When we clean the positives, eliminating the duplication, triplication, and we're improving the data, and we're having an interaction with the Institute of it's called Institute of the Institute of Data, the one that analyzes data in Puerto Rico. We had met with them to basically provide them with all the information so they can reanalyze it. But we have other indicators that relate to the behavior and the way that the healthcare system is behaving that makes us feel not safe, not in peace, but with some degree of comfort to open some of the business that are of value to the country, specifically first line business that can provide a service that is needed to the country.
Okay, fair. I hear you. The capacity at the hospitals, they can do much more than they're doing. Most of the beds around the island are empty. But at the end of the day, you know that the CDC recommendations are for testing and contact tracing. And I say you, sir, not meant directly at you because you came into this job late, but your department, that which you oversee, has been almost failing at every level to do it at an adequate level that you yourself want to do it. So when you start easing up on things and you start saying, well, we've got to supply PPE and testing, you can't even do more than 200 tests a day. So how are you going to, within the next 2 weeks, be in a place where, I mean, where are you going to get these tests from? You can't even, you can, I'm not understanding it.
We have, one of the things that happened, you know, that there has been the issue about buying the rapid test. When we look at the data, the inventory that we have in the range of about 150,000 tests that were delivered to different sites and are not in use. I've talked to physicians that tells me we have them, but we're not using it because they do not meet criteria. Today, we ease the criteria. You know, we need a order by a physician. We're using telemedicine. A physician can give an order through the phone in a text message so that the test can be done. Likewise, we have met with groups of high risk, specifically the elderly, the people that lives in the early homes. So we're doing aggressively over that group with 30,000 tests. Today, we met with the people, the homeless groups, and we're going to try to figure out how to do at least 10,000 people within that group within the next few days so that we can have that high-risk group. Likewise, we ease the issue for physicians, and I said to them, please order the test. There's a lot of risk groups, meaning just kids, people over 65 in Puerto Rico. People, the higher group in percentage of positives is a group of 40 to 60. For me, it's a high risk. So order it, use the system. The same thing, the second thing we did was to provide the country with the template as to where are the 150,000 tests that belongs to the country, the government. And we're saying this site has 100, this other site has 200. So we're trying to increase the level of the use of what is available out there. One of the things that I want to see before, and you know, this is in media, but one of the things that I want to see is that 21,000 number. And what does it mean? It is being stated when I said the second day of my tenure that we need 6,000 tests per million to have solid data to at least drive a model. And that will translate, if we count 3.5 million people in Puerto Rico, it's about 21,000 tests. I've talked to the epidemiology group today. We need 21,000 tests by this weekend. Simple as that. You know, we have about 12,000. Interestingly, and if you look at the 12,000, we have almost 2,000 that are pending results. So yes, I know that. But with the data that we have, this is statistical model. But the behavioral component, which relates to the use of the healthcare services and the claim every single day from the hospital association as well as the providers in the periphery, is telling me that we're doing something well. It's not measuring numbers, but the quarantine has translated into a better outcome, and it's protecting our country.
And that so, I hear you on. But listen, when I first interviewed you 4 weeks ago, you gave me all kinds of things that you wanted to do. Most of them you have not been able to do. Get more tests, do more testing, do more contact tracing. Now listen, I've already told you, you are the one refreshing political figure on the island who I like to interview, because you seem somewhat candid and forthcoming. Not seem, let me be more gracious than that. You are, based on what I know, okay? So you haven't been able to meet what we've talked about for the last 4 weeks. So I hear you. I get that the quarantine has been the most effective thing the government has arguably done. But when you talk about those 250,000 rapid tests, those rapid tests are generally used to see if anyone has been infected in the past. It's not the PCR test that is the most conclusive, that determines whether or not you're negative or you're positive. So are you worried about basing your decision to give a recommendation to reopen on some tests that are, rapid tests are not the ideal test to give. The PCR is is the ideal one, but you can't get your hands, and I'm not saying you're not trying to, but you just have not been able to do it. The government has not been able to do it, yet you're saying, I think we can open up.
And when we look at the CDC phase 1, phase 2 levels, phase 3, yes, we're not there in phase 1. We want to have a solid effort in testing, close. And we are really, really solid tracing. So I clearly agree. Likewise, we see the other variables are not there, which is, as I said, and I will repeat them, which is, it's just to emphasize the value of the fact that this distancing has led us to have healthcare capacity that could help us. If we were to increase, let's say, if we were to open any business, one of the things that I will follow closely is whether or not we hit 35, 40, 50% of our service capacity, specifically intensive care unit, ventilators, and I will immediately say, let's turn back. So yes, I'm looking at something. Do not assume that this is irrational. This is just based on the data that we have. There's a lot of pressure. You know how the business is. You know how the different entities that are of value to the country. What I will not do is.
Let me pause you for a minute. Okay, so you have 65% of capacity available on the island. Let's say you open things back up. Remember, you are under the most restrictive quarantine of any state or territory. So let's say you start to open it up. Well, then you're responsible for sending people into work who may arguably get infected, and your capacity goes from 65 empty to where you're over capacity.
And one of the things that I do believe is going to play really strong on this is the behavioral component, human behaviors. I do believe people are scared. People are going to be responsible in regards to what to do. The entities that will drive this effort, the business, has to be responsible. What is not responsible is opening the beach, like Florida. That is irresponsible. What is not irresponsible is opening the gyms and the hair places, the hair salons, like in Florida or Georgia.
So what is your recommendation on what should be reopened?
The information that was provided to us based on risk levels, based on the capacity to deliver the goods, based on the element of distancing, based on a lot of other variables, and it's going to be discussed with the governor this coming, I think, between tomorrow and Friday. Construction was one of the elements that was provided to us, and they provided us with clear understanding as to why construction. I don't mean construction about rebuilding a home or remodeling a home. There are construction that is of value to the country, specifically roads, specifically the cleaning of the areas. So there is construction to construction as a number one. And when they look at the data using many different models, which was really beautiful, the effort they have done statistically and in terms of the model they use, they recognize that construction is the entity that has the element of distancing, that has the element of the need for the country to keep moving on to business, and that the group is willing to abide by the rules that are going to be imposed before they can open, including testing to the complete crew, complete. And yes, we know we have the testing. We have about 50,000. The complete crew. Let's say if there is a group construction is going to lead to 5,000 people, we will test them before they start. The second thing was tracing. Third thing was personal protective equipment. So there's a lot of elements, and there's a self-assessment by the entities, which has to deal with human responsibility. So this is not irrational. There will be a point that I will be able to provide all of this information. Part of that is mine. Part of that is part of the group that has done the work regarding the economy. But that's one example. And they have done a beautiful, beautiful job that is rational, that is data driven, that is using the input from many other models of the world, and they have come up with some ideas, not ideas, something that is supported with data. And yes, indeed, it's not our data, it's the data of the world. And we're saying this is applicable to us. So what is a threshold? A threshold is if we drive this and we see that our capacity hits 50%, we roll back.
You mean if your hospital capacity is over 50, you roll? Okay.
If we see, and remember, this is going to be localized. So there's data from a group in Ponce, which is in the south part. There's a lot of people doing a good job, and I look at this every single day. The data from Ponce, and I'm not sure if I'm allowed to provide it, but it's people that are really motivated, people in the science group, medical school, the scientists, the physicians in that site. They have done. What they did was to do a screening, and it's based symptom driven. It's inventories that people complete and provided to this people. It's about 40,000 the people that reported or answer this questionnaire. And it's interesting because they provided us with a map that shows the hotspots. And it's pretty consistent with the scant data that we have, which is San Juan. And we can say that this is basically where there's more concentration of population. Indeed, no questions about that. San Juan, Caguas, Ponce, Mayagüez. But it's interesting that by means of symptoms of people that have provided that information, that is replicated. So there's data. The fact that the presumption that scientists will look for data anywhere it is. And in addition to that, and I cannot call myself a scientist, I'm a rational person, I'm a physician. And I want to believe that I'm part of that. But I look at the data. I read every single data that is out there every single day, every single data. And I'm going to use it to see whether or not it's applicable to Puerto Rico and whether or not we can use it to make decisions.
All right. There's been that mess with the $38 million in tests that were canceled. Okay, fine. I don't want to focus on rehashing about that right now. I have some questions for you. Who is in charge? Are you or the task force? Are they your boss or are you their boss?
The task force at this point in time, they're dealing with investigation in the Cámara, the Congress. I am the boss since the first day I started. I started a Saturday when I was confirmed. I met with the task force on Sunday, and I clearly established that by means of the government, the legal system in Puerto Rico, I'm the one responsible for making the last decision, and I'm responsible for the consequences, and I'm the accountable person and entity. So from then on, I will take complete ownership and responsibility of every single effort. I'm going to tell you an example. We got the ventilators. We had an order of 15 ventilators. Okay, that was the 6:30 announcement. So we got the 15 ventilators from Cardinal Company, which is a well-known company in the United States. And the first thing that they said was, we cannot receive them unless Lorenzo signs for them. What I did, we have them in Puerto Rico. I called the company. I said, give me just simple information. What I need from you is the following. Was the price of that ventilator prior to the crisis of COVID the same? And if that is the case, I will keep them. If there is a different price, and if this is the price that you sell it to the country and the world, I will take it. I will take responsibility, and I signed for it. So we have 15 additional ones. $30,000 a piece. We have other ones for $18,000 a piece. They have whistles and whatever. They're the catalogs of the ventilators. But I did the due process within the scope of what I have at this point in time. Will I let them go? No. Same thing. We had 49,000 tests that we received at $36 a piece for one of the companies in discussion. And it's being paid fully.
49,000 PCR tests or rapid tests?
Rapid tests. But I need them too. So they were paid fully, 100% of the payment. they still have to give us 51,000 additional. And what I said was, I have a court case at this point in time within the Justice Department and our legal department. I said, I'm going to keep them because I need them. But the next 51,000, there has to be an adjustment to price related to the business at this point in time, the market the way it is right now. We're in the court. We're in the legal system, the civil system. It's a contract. I'm going to do everything that we need to do to protect our money. But I need to test. So somebody order it. Is there flaws in the process? Indeed, in every single element. We will correct that. Today we had a meeting with the people with the judicial department. There's many investigations, federal, local, state, and the Congress. We will provide them with every single piece of information. If something was done illegally, they need to pay the price.
Let's talk about the PCR test. There was the $38 million scandal of the test that never turned out to be because that was canceled. Have you secured more PCR tests?
We have at this point in time today in Puerto Rico, we have within the Department of Health the capacity, reactives, the reagents to do around 9,000 additional tests. We're using that for first responders. I've said that before. We had an issue this past weekend in the jail system, juvenile delinquent site, where we were called by the secretary. I immediately responded to that. We sent what is called physicians to the site, and we did 40 kids and 17 staff members, so a total of 57. We have the first responders on a drive-through, and we plan to open across the country the range of about, I think, 8 spots for first responders. It's going to be in sites like commercial centers, parking spots. So we plan to do that for first responders. So we are using it for first responders. We had discussion with blood banks. You know that in Puerto Rico, we have already done 4 cases of the plasma with antibodies. And so one of the discussions that we had, I think was yesterday or Monday with blood banks, was if I give them the list of the people that were positive day 0 and 14 days after are negative, they did not have symptoms, not negative, they did not have symptoms, whether or not I was willing to do the PCR so that they can use it as a blood donor. So we have that in place, and we're using it strategically. We have today in the range of about 8 to 9,000 for 9,000 PCR within the Department of Health. There was a concern about one of the private sites called Toledo, a lab that had initially stated they had capacity for 250, then they increased to 500. Reportedly, they something happened with their reagents, and so we're dealing with that. And we're working on the new machines, fighting every single day for reactives and for reagents. You know, we have the 15 machines, and remember you had said if I could do something. Yes, indeed. You know, Puerto Rico has 15 machines. I think it's a company is Abbott. It's a fast testing or rapid test for PCR. We have not yet received the reagents for those 15 machines. That could help us in a lot of things. The airport, the blood banks will be a place where we can provide one to each one of the 2 blood banks to do fast PCR for blood donors, and then to strategically distribute them across the country, and one to the the jail system that has about 10,000 people, so that we can work on first responders and the patients there. So we think about it. We don't have the reagents. I wish we had it. And if there's anything the country can do, you know, the United States, and if they listen to this, we will love to have that and will be of a lot of help.
Okay, but what are you doing to get more PCR tests? You need thousands and thousands more.
We're looking at we did RFPs for the excess capacity, and we did an RFP for a test and PPE. So we're saying to people, you have it to deliver, to supply it. Let's talk about the business within the scope of model, you know, that we have internally, so that we can buy it. So we have a team of 5 people that have even appointed to that process to look at the offers, to see what is available in the business, the market, and reach out to and buy.
I'm not trying to be a jerk, but you've been on the job for 4 weeks. What the hell's taking so long?
It is, you know what, probably, and I will say probably I rely on the 20,000 rapid tests that we have and the 8,000 that we have for the PCR. So probably, you know, I need to turn the engines on. No questions about it. I need to put it on drive. So and I will, today I call about the 50,000. Probably I'm just hoping that will come because that will be such a great value added to our country. But yes, I need to so many things, David. It's a lot. It's a lot.
I hear you. I hear you, sir. But in terms of itemizing things, the PCR and the contact tracing, correct me if I'm wrong, shouldn't that be your top priority?
Contact tracing is moving. We have at this point in time of the positives, and I will want to have the data, and I will provide it with Michelle. But of the positives, we have the people positive as well as a contact of those positives, and we have in the tracing in the range of about 85% of the people that contacted or had contact with those positives being traced. So we have a tracing process in place. Likewise, we did meet with all the mayors of the country, with all of them, through the two associations. One is Association of Mayors, other is Federation of Mayors, and we have provided them with the list of using, the flexibility that was given to us by the HIPAA regulation through HHS. We provided them with the names of the patients, last names, the specific address, phone numbers, and they're doing a reach out also. So something is happening. Do not, please do not believe or do not assume that there's no tracing. Yes, there's indeed tracing. Is it perfect? No, but we're doing tracing at this point in time.
Okay, but the PCRs, I want to be able to interview you again and say that you've gotten your hands on some or you're trying.
And give me, you have learned from me. Give me 24, 48 hours. Today is Wednesday. Let's talk Friday, and I will tell you what response I've had from the entities.
Because once you try, if you can't get any, then that's a story of you trying to get some. But I listen, as I said, I'm rooting for you because I'm rooting for the people. Your best line of defense is to get more PCR tests. I just don't understand why that's not.
We put the order.
Not banging on a wall.
Yeah, we put the order through the FEMA, and there's evidence. I can provide you with that information, the number, the world with that, and I've been really open with the information we have. But yes, indeed, I will put the calls that I need to put. Indeed, I think I can do more. Better.
And listen, if you're willing to give me that paperwork showing that you did put in the order and for how many, I will publish that, and I will then call FEMA and find out what the heck is taking so long.
I will. I don't have it immediately. Yes, I think I have it on my cell phone. I will immediately send it to you so I can see that indeed this is not. This is real. This is true.
Listen, you've got a lot on your plate. We've spent 30 minutes. I'm not going to take any more of your time. I could ask you 100 more questions, but at the end of the day, I wanted to stick to what is the most pressing. There's a lot of other stories, but this is what I wanted to get to. So thank you.
And I will, my compromise is that if you text me, if I cannot provide you with information, I will send you a text to give you some feedback as to why I'm not responding.